Dr. DeReese started her career in pharmacy in 1980 as a pharmacy technician, where she practiced for 13 years before she moved on and received her Doctor of Pharmacy degree. She is originally from Tulsa, Oklahoma, and now she resides in Houston, Texas, and she has been a valued member of PCCA for 34 years, where she has contributed extensively to the field of pharmacy compounding and education. So please join me in welcoming Dr. Annie DeReese.
Thank you, Asia. Well, good morning, everybody. Good morning. Awesome. Just a quick show of hands here live. How many of you have done non-sterile bulk compounding from scratch? Raise your hands. Oh, quite a few. Great. All right. Online, virtual, if you've ever done non-sterile bulk compounding, if you can just raise your hand. We'll get just a little tally there. Looks like quite a few of us had that experience. So this morning we're going to talk about regulatory insights for non-sterile compounding and then discuss a few opportunities for technicians in the compounding world. But it's important to understand what it is you have to go through. And if you have currently a sterile compounding background, then if you attended Brenda Jensen's meeting yesterday, there are certain competencies that you have to meet on the sterile side. So just like the non-sterile side, we have the same competencies, or they're a little bit different. But nevertheless, you have to be found competent in order to compound. The objectives are explain who the USP is and describe their requirements for personnel in compounding, discuss the role of pharmacy technician in a compounding practice, and then also review the Drug Supply Chain Security Act and where it is applicable. So first, let's start with who the USP is. USP stands for United States Pharmacopoeia. They are an independent scientific nonprofit organization, and they work together with pharmaceutical industry, bulk chemical suppliers, pharmacies, and what they do is they'll write a monograph. For example, morphine sulfate. So they've gotten together with the bulk chemical maker, the manufacturer of that bulk chemical, and they will decide on the limit of impurities, endotoxins if applicable, solubility, color of the powder. And when everybody has come to an agreement, then they will write what they call a monograph, and then it can be found in the USP chapter. They also write same monographs for finished dosage forms. So morphine tablets, morphine solution, morphine elixir, whatever. Lorazepam tablets, there will be a USP monograph for that. So that is how USP works. And they also provide standards of identity, strength, and quality and purity of even dietary supplements. So you see on your slide that there's two boxes. One says USP NF. That is where drugs are covered and also biologics. And then another area, they have dietary supplement standards. So all your vitamins, all your nutritional supplements that have USP behind the active ingredient will also have that same monograph. So the USP has written the chapter 795, which was released in November 1st of 2023. And it was designed to minimize harm for us as compounders and the patient, and then also the environment in which we work. So we want to remove the possibility of excessive microbial contamination, variability of the strength. So when you compound something, you need to be within a range, and they're allowing plus or minus 10%. But something that has a narrow therapeutic index, that 10% could be harmful to somebody. So we want to be more on the lesser side of that 10%. Is there any physical or chemical incompatibilities and any other type of contaminants? Did you accidentally bring in something into your hood and contaminate your dosage form? And then you want to make sure that you're using ingredients that are appropriate quality. So they establish a lot of standards, training expectations, competencies that you must be found to be competent in. Documentation is huge in this chapter. Garbing. How many of you are familiar with 795? Raise your hand. A few of you. Okay. You have to be familiar with it if you're doing 797. Cleaning schedules, beyond use dates. Water of activity. And that's not the amount of water that's in your formula. It's the amount of water that's inherent in that bulk API, such as like morphine. It contains water naturally. And then responsibilities. So they say you have to have designated persons, which can be more than one. Other key points, they incorporate USP 800, which is hazardous drugs, into the chapter. And they also, this is a big win for compounders if you don't do sterile, nasal sprays and nasal irrigations do not have to be sterile. So in previous versions, their language was a little bit vague, and it seemed like they wanted it to be sterile. The other thing is your this chapter describes minimum standards. So when I teach compounding, I implement best practices, which I hope to impart some of that on you all if you're still doing non-sterile compounding. What's important to understand is your State Board of Pharmacy must adopt 795 for it to be applicable and for them to enforce it in your state. So you need to know your state rules. In Texas, they have taken out parts of it. So they could not adopt 795 as is, and they made us be competent is one of them. So be aware of what your State Board of Pharmacy has adopted and therefore what they will inspect on. They also defined non-sterile compounding as combining, admixing, pooling, reconstituting outside of what the package insert says. So if you're reconstituting amoxicillin suspension per the package insert, is that considered compounding? What do y'all think? No, because it tells you how to do it in the package insert and you're not deviating from that. So what about splitting or cutting tablets? It is not considered to be compounding. There are some FDA-approved compounding kits out there, so therefore that's not considered compounding. However, there are some that are not FDA-approved. If you use those non-approved kits, then you could consider that to be compounding. If you add a flavor to a conventionally prepared product, so now Mom wants you to add some flavor to that amoxicillin, that's compounding because the manufacturer did not tell you or give direction on how to do that. So compounded non-sterile products must comply with this chapter. These are the dosage forms that they are affected. Basically, anything you make. Okay, solid oral preparations, so capsules, lozenges, liquid oral preparations, rectal preparations if you do enemas, vaginal preparations, topicals, so your creams, gels, and ointments, nasal and sinus preparations intended for local application. So this would exclude any type of irrigation or breathing treatment. So anything going into the lungs must be sterile, okay? And then otic preparation. So if you get a compound for the ear, you might just want to chat with the mom or the physician and find out if the child has, or the person has a perforated eardrum. If they do, that compound would need to be sterile. So what else did they say? Well, standard operating procedures are required, and that is a huge world for us. Also, designated person, which is identified in the SOP. So today, we all are a non-sterile compounding pharmacy, every one of us in this room, and we have a couple of owners. We have Roxanne and Yanni. They are owners of this facility. And then they have appointed Stephanie and Rita as our designated people. Stephanie's going to have the chore of being in charge of personnel. Rita's going to have the chore of being over facility, okay? And they both answer to Roxanne and Yanni. They are our owners. So what do the DPs do? Well, the whole facility, personnel, and building are in those two arms, okay? So they're going to put together training programs. They're going to make sure that we're competent. They're going to make sure that there's no water stains in the ceiling. And they'll go to the owners and say, hey, we need some money to fix this, or personnel is having an issue or whatever. So that is their job. And then they will also run assessments of our skill set and then determine if we are competent or not. So also, they're going to monitor and observe all the actions in the pharmacy. They're going to ensure that all the SOPs that they write are implemented. So between Rita and Stephanie, they're both going to sit down and write SOPs as it relates to the job duties that we're doing. So if I am a compounder on Mondays and Tuesdays, then they will give me an assignment of what I'm going to make, whatever prescriptions are coming in, but I have to be trained on all those dosage forms too. They can't just give me a new dosage form because I've not been trained on it and found competent in it as well. So they too have to be found competent and knowledgeable. So whatever training program that Rita and Stephanie write, they have to pass themselves. And so they can find videos, they can find training tapes or whatever, or they can write their own program. And then all of us would be expected to do that. And then when I'm ready, I would come and say, hey, I'm ready for this. So for example, hand hygiene. Believe it or not, we have to know how to properly wash our hands. And so I teach the World Health Organization method where you wash all the way to the elbow. So Stephanie, how far are we going to wash our hands? What are you going to write that training program to? Are we going to wash to the wrist, mid forearm, elbow? What is your thought? Okay, make sure you use your mics.
Elbow.
Elbow? Okay, all right. All right, so she has written a program, and during the training of it, she has to physically watch me on every one of the competencies and every one of your competencies as well. So she's written a program, I've watched a video, and then I go to her and say, okay, I'm ready for practice runs. So we go over to the sink, and I wash appropriately. She coaches me if I screw up. And then when I feel like I'm confident and I'm ready to take her test, I simply go to Stephanie and say, hey, Stephanie, I'm ready for my competency on hand washing. So she's got a pre-made form that lists all the points that I need to hit. So I go in there and I wash. She cannot coach me. That's cheating. She can't tell me, oh, you want to do that again? That's cheating. I have to be able to execute it flawlessly. They don't say that in 795, but what's the point of being competent if you're cheating, right? So I pass. And then I've moved on to these other ones like garbing, okay? Garbing is putting on a face mask for men, beard cover, hair bonnet, gloves, and a gown. And she's decided that we're not going to wear booties because we're not doing HD, but we would wear booties on 800 side. And she's decided also that we're going to wear 2 pairs of gloves. That is a best practice because what 795 says is you want to wear 1. Well, as a best practice, and here's the why behind it. Have you ever put on a pair of gloves, taken them off, and then tried to put on another pair? What happens? Sweaty hands, right? So why not wear 2? And I even tell people on the sterile side, wear 2 pair, because that way off and on at the top pair is a lot easier. So that's a best practice. I also advocate to wear gloves that are intended for 800 on the non-800 side because they can go up longer and they're a thicker mill glove. And it's so much easier just removing that top pair. So here are the areas that we all will be tested on and found competent in. So hand hygiene, garbing, the order of garbing, making sure that when we shake out our gown, nothing touches the floor like the sleeves. Cleaning and sanitizing the room, the shelves, the hood. Handling and transporting components. Can you walk across the lab room with a bottle of glacial acetic acid, which is in glass, and not carry it by the lid, which may not be on good? And if you did that, it could come off and it break. And then furthermore, is there somebody on staff that can clean up a spill? So you would need to be trained in spill kits also, which is not mentioned in there, but it's a best practice and makes sense, right? So Roxanne has written a program for safety and has included that. And so that's something that Stephanie would train us on. Proper use of equipment and devices, selected compound. So if you have an ointment mill, you need to learn how to properly clean it so you don't contaminate your next compound that you process through it. Same thing with electronic mortar and pestle. It's just a blade, but an understanding how to clean and care for these things because not everything can go in the dishwasher. And then documentation of the compounding process. So you're going to have a master formula record, and then you're going to have your compounding record. Your master formula serves as your original. Your compounding record is what you take notes on as you process or make your compound. If you have to check the pH, you would put what the original pH was and then how much of the hydrochloric acid or whatever agent you're using to titrate your pH to, and then you would have your final pH recommended on there or documented on there as well. So it becomes a compounding record and must be kept for a few years. So again, these are all things that we have to be trained on, observed on, and then all these observations, all these sheets of paper that Stephanie's gathering would go into my personnel folder to show if FDA or State Board of Pharmacy walked in, they're going to see any DeReese's or Yanni's personnel folder. Show me where they've been trained and what does your training program look like. So it needs to be robust enough to where people can pass the test as well. So I just kind of talked about this, but what I want to tell you is 1 year from today, I'm going to do this again, unfortunately. And we've been doing this all the time. But that is part of 795, is it's an annual training, an annual competency. Because, sometimes when the boss isn't looking, we may take a shortcut. I know we've all been there. We've all done that. Hopefully the shortcut hasn't hurt anybody, but we just want to, make sure that we all can remember things as we go forth. We also need to read and understand certificate of analysis. What is that information telling us? What is it showing us? Same thing with safety data sheet. If we were to accidentally drop a bottle of progesterone on the floor and it broke and progesterone powder flew out in the room, which is an HD drug, by the way, how do you clean it up? What are your tools that you need? So inside your compounding lab should be a spill kit, okay? That would include extra pairs of gloves, large bags for disposal, and then where are you going to dispose of this? If it's HD, you can't just put it in your trash. So knowing all these things, and so Rita has, since she's in charge of the building, she's got all this written down, and we've been trained on it too. So we all are very aware of all of these policies. So bottom line, no compounding can be done until you pass all the competencies. So if we're all employed on the same day, we're not turning out anything for a while, right? Because we all have to be found competent. One way to prove competency is through potency testing. So, and I'm an advocate of, for example, if I'm the DP and Asia, I need you to make these progesterone capsules. It's 4 o'clock on a Friday. And she's already mentally checked out. She's planning happy hour, okay? What are the chances that she's going to fall within that 10% potency range? What do y'all think? Low, someone says? I don't know. Maybe she's not a big partier and at 4 o'clock on a Friday, she's okay. But that's when I would recommend that you do, and you don't tell the staff that you're going to send it out for potency because you want to know, are they taking shortcuts? Did they weigh too much on the balance? Do you have your balance hooked up to a printer or into a quality control electronic system that will record this stuff? If you don't, unless you go in and do a visual checkoff, which as pharmacists should, go in and verify that the number, if you don't have a quality control system hooked up to your printer, or your balance rather, how do you verify the amount that's weighed? So there again, high pressure is kind of at a time when we make mistakes, and so that would be a good time in my mind to do a potency test, and you don't tell them. All right, you're the compounders. What is your responsibility? Well, besides understanding that you need to be competent in how long you need to wash for, they tell you have to use soap and a minimum of 30 seconds. And then they want you to use disposable wipes. I'm going to suggest that paper towel does not have a role or a place in compounding pharmacies, sterile or especially sterile, but even in the non-sterile side. What happens when you rip a sheet? Particles. So they make low-lint towels, and they make them on a roll, but even when you still tear those, you still will get a few. So at my where I teach, we have this bag. It's a CE, right? I can't talk about brands or anything? Please don't. Okay. All right, thank you. There's a company out there that has bags of low-lint towels and a stand that you can put them in, and then you just grab one as you need, okay? That's what, and they are low-lint. Get paper towels out. I know on the sterile side, you cannot use refillable hand soap. I would say let's just implement that on the non-sterile side as well. What happens when at home, when you want to refill your hand soap that's got the dip tube in it with the pump? So you open it up, and you've got your bottle of soap that you're going to refill it. Where do you put that pump tube? On your counter. When did you clean your counter last? So when you refill your soap, and you pick that dip tube back up and put it into the bottle, what'd you just do? Contaminate. So even on your 795 side, I would suggest just those little dispensers that will dispense soap that come in bags, and then you throw away the bag and you just replace. All right, something else that you all have to do. You have to tell Stephanie if you're ill. So Stephanie, I'm supposed to be in the compounding lab today, and I just got off of a cruise, and I'm really sunburned and flaking. Can I work in the lab today?
I would say no, because you're shedding too many particles.
Well, they're clean particles. I'm not a microbe.
You don't know that they're all clean.
I bathed today. So the answer is no? That's what you're telling me?
The answer is no.
Okay, so what am I going to do?
Might as well just go home.
So I'm going to take a personal day?
Yeah.
Man, she's rough. All right. How many of you would go to Stephanie knowing what she just said and tell her that you're sick? Because she's going to make you burn a vacation day, y'all. How many would go back to her? Raise your hand. Oh, you're the Lone Ranger, girl. You're good. She likes you. Okay, all this to say, build a culture in your practice where you have easy, open communication. It's important. There could be other things that I could have done. She could have said, well, since you're, shedding skin, you're going to work in the main pharmacy today. Or you're going to go clean a toilet or take out the trash or do something else. So she could have given me an alternative. And then that makes me want to come back to her and say, hey, you know what? I got this cough. I really don't think I should be in the lab. And she could say, well, we're going to put you on the line somewhere else, okay? That's what I'm getting to. Don't make it punitive, because then none of you would go back and tell her because you all didn't raise your hand, all right? So have that open line of communication. Now, she is in her right mind to tell me to take a vacation day if I'm coughing and hacking all over the place, because it says here, if you have an active respiratory infection, you're not to be in the lab. You shouldn't be at work. But what do? We come to work, right? If you have conjunctivitis, you're not going to be compounding in the lab. Rash or oozing sores, so decubitus ulcer, or if you've got diabetes and you have some type of ulcer somewhere, don't get in the lab. Don't even come to work, probably. What about a recent tattoo? And that's their words. So who can define a recent tattoo?
It's like an intentional wound to the skin.
Okay, an intentional wound to the skin. Define the word recent. Use your microphone, please. Thank you.
I would say probably within the first week or two of getting it.
Okay, so would it depend on size, area? I have a nod heading back here. Would you get on the mic and tell us what your thoughts are? You got to hold it.
It would depend on the size, the area, and then sometimes the color. They heal faster. I would say anything that is still in an active healing process would be considered recent.
Okay, define healing process. What does that look like? What does that skin look like?
If there's any scabbing, or if you're still like applying your ointments to it, anything like that.
That's what I want to hear. I want to know the physical description, because Stephanie and Rita are going to write that in the SOP for health issues that must be reported. Because a recent tattoo to some people, it may be okay if it's scabbed over or whatever, because it's not oozing or anything, and they may think it's okay to work. But they need to define that. And what is your comfort level? Would you let someone be in the compounding lab if they have a tattoo that has a scab on it?
No.
Thank you. Owners?
No.
Okay. So they would have an SOP on that, and we all would be trained on that. And then I want to jump back to SOPs, because when they present the SOPs to us on all this stuff in the pharmacy, we're going to sign a copy that says we've read it and we understand it, and therefore you're going to practice it, okay? So we all are on the same page, and this is why we have to have an annual review. And part of their job, too, is to review maybe every month or every quarter the SOPs to find out, are they still applicable? And then if they were to bring in a new piece of equipment, Rita's going to write an SOP on an ointment mill, because we didn't have one before, or a speed mixer, or an EMP, or a rectal rocket mold. Whatever piece of equipment came in, she's going to write an SOP on its use and how to clean it. And then we all would be called in on a Monday morning, 7 o'clock, be trained on it, sign off on it, and then it's implemented, okay? So all this to say, It is your job as a compounder to let your employer know if you are under the weather, and if you have any of this, you need to have the open-minded communication. And as bosses, managers, DPs, owners, whatever, please don't make it punitive. However, exercise caution if they're coughing and hacking and you feel like they are at risk, certainly send them home. Personal preparation, at a minimum, there's no outer garments, no hats, coats, jackets. You have to remove all your hand and wrist jewelry, including piercings that could interfere with the effectiveness of garbing or hand hygiene. So some of us have permanent jewelry. It may be a bracelet. Does it interfere with wearing gloves? Could it poke a hole? I don't know. That's an assessment that Stephanie would make since she's over personnel. What about a bracelet on the anklet that's permanent? Does that interfere with anything? No, that's fine. Remove earbuds and headphones. So those are not allowed. However, we can make accommodations. So if someone has a hearing loss and needs to wear a hearing aid, certainly that can be accommodated. So garbing, PPE, you have to wear gloves. They don't tell you how many. So it's just a common sense factor of the ease of coming in and out of your hood and all of that. Shoe covers, head covers, facial hair covers, face masks, gowns, all must be worn appropriate. And I think they're referring back to 800 here, because if you are doing 800 and it has been adopted by your state or your facility is just implementing it to be safe, then that's where you would wear 2 pairs of booties and 2 pairs of gloves for sure, and a different type of gown. So you want to remove your gown when leaving the compounding area. Reusable gowns are allowed only during the same shift. So define shift for me, Rita. The word shift, I know what it is, but is it, in this case, my shift to work in the lab is 8 to 5, but I get a lunch break. So are you going to call a shift 8 to noon, or is it 8 to 5? Just push down and hold.
I would do 8 to 12, have a break, and then another one, maybe 1 to 5.
All right, let me ask you this. Am I going to wear the gown from 8 to 12 and then dispose of it and then get a new gown from 1 to 5? Or am I going to hang that gown up and then wear it for the second shift?
You would have to change the first one and then get a new one on the second.
So I would trash that. Okay, now I'm going to go to my owners. Yanni, that's some money, honey.
I believe 8 to 5 will be a shift.
Okay.
So you should be able, unless that garb is soiled, you should be able to save it through that.
Okay, so the money man said he's going to allow us to wear the same gown all day unless it's soiled, torn, or compromised. Okay, but here's something I want you to think about. So we're working with powders, and we are working inside of a powder containment hood, and the sleeves of that are inside the hood. Okay, and it's being exposed to all these chemicals, whatever we're making all day long. It may be wise to wear sleeve covers, non-sterile, and then you change them off after every compound. Not required. They don't talk about it. Maybe we change the gown after the 4-hour shift and they get a new gown the second shift. Now, I would advocate for a new mask and a new head bonnet per shift. That would be me. So that would be something that ownership would work out with the DPs as far as, what kind of PPE changes we're going to make. And then it would be written in an SOP, and we all would be trained on it, understanding the times that we would change. All right, now we're going to talk about active pharmaceutical ingredients, so your raw chemicals. So they must have a USP NF monograph. They must have a C of A. And if the chemicals coming from the USA, be from an FDA registered facility. And then if it comes from outside, it should be comply with laws and regulations of applicable regulatory jurisdiction. So things like lactose, microcrystalline cellulose, all of that should have a C of A. And then come from a USP FDA registered facility. In the US, come from an FDA registered facility. And if not, then it is Rita's job to discern is that vendor good? I mean, have they been inspected recently by the FDA? Don't know. But she would do her vendor qualification because she's in charge of facility. So where she buys our raw chemicals, she would be looking at their inspection records, okay? So that's huge. That is a huge job for you as facility. So the FDA has a document on insanitary conditions, and it's a guidance document that they wrote in November 2020. And basically, they want to make sure that you don't have USP-graded chemicals that have a high level of impurities. And this is what I want to say. So USP, as I mentioned earlier, has that monograph, and it will allow for impurities, sometimes endotoxins, and it will state that. But manufacturer A may manufacture the powder at this level for impurities. Manufacturer B may manufacture that powder at this level of impurities. How do those levels of impurities affect solubility, compatibility in your formulas and things like that? We've seen a lot of issues with some topical hair growth preparations in the compounding world having problems with solubility. And it all came from various vendors. So knowing things like that is huge. Y'all know you can buy chemicals on Amazon? Unfortunately, and they're labeled as research grade and things like that. So please don't do that. That's not appropriate. All right. So bottom line, there's no injectable peptides. So we cannot compound those. They do not have a USP monograph. Yes, I know people do it, but you're not supposed to. Do not copycat commercially available products. So if you're going to compound something, you need to make sure it's on the drug shortage list, okay? If you're going to use bulk chemicals, which you can compound from crushed tablets, if you're going to make a suspension, that's fine because it's in an FDA-approved product. So bulk chemicals need to have USP or NF grade. We cannot use vitamins as an active ingredient. It can be in your formula, but it cannot be the active ingredient, okay? It has to have been in an FDA-approved manufactured product. And then it can be found, you can use it if it's found on the Category 1 bulks list of the FDA. And then you want to do your vendor qualification. So if you're outsourcing a big kilo of chemical from a vendor in India, you want to find out make sure they're FDA registered, but then also find out when was the last time they've been inspected. And then you must have a valid certificate of analysis for that lot. So every lot you purchase would come with its own C of A, and you cannot mix lots and C of A's at all. When it comes to water, this hurts us financially because purified water is horribly expensive. And an option to that for your compounding formulas, you can use sterile water for injection. I have found 100 ml bottles that I use in my training class when we make a nasal spray, really cheap. Cheaper than what you can find in some of those online places. So, and it's once you have to understand what the BUD is on that bottle. If you open a liter bottle of sodium water, sterile water for irrigation, how long is it good for once it's open? So look at your labeling, all of that. So you can find it in small quantities if that need arises. There is a chapter 1231 on water for pharmaceutical purposes, and it just defines how purified water is gotten, okay? So what is your water approved for? Distilled water we cannot use. And if you have a reverse osmosis system in your pharmacy, you need to be testing it to make sure there's no growth going because it's going through filters, and if you don't change out your filters or get it tested, you never know when you might have contaminated water. So there's other regulatory bodies such as the FDA and the state board. So the FDA in 1997 passed FDAMA, and it established Section 503A, which is our mom and pop compounding pharmacies. They exempted compounded drugs from new drug requirements. So we're not manufacturers, we are compounding pharmacies, so therefore we don't have to go through and prove safety and efficacy and all those things like a manufacturer would. It allows patient-specific medication, meaning Mrs. Jones walks into our pharmacy with a prescription for progesterone suppositories that is patient-specific. I'm not doing anticipatory compounding, although that may be an issue in some places. And then we're also exempt from CGMP, Good Manufacturing Practices, that is a requirement for manufacturers. So they have to follow those FDA guidelines. Then later on, they passed DQSA in 2013, which set up for Section 503Bs, which is they are FDA registered. They follow CGMP guidelines of the FDA, and then they can bulk compound and primarily sell to health systems. And they're more in line with providing things that are on drug shortage lists, okay? So that's the difference between the two. So FDA inspections, they will they will come visit mom and pop compounding stores, especially if they see them advertise on their website or anywhere public claims. That is a trigger for the FDA. You do not say, I can compound nicotine lollipops to help you quit smoking. That is a claim. So they are out doing inspections, and they don't base their inspection on that state's rules. They have their own set of guidelines. So for a fun read, in Sanitary Conditions came out in November 2020. And then they also have bulk drug substances for 503A compounding pharmacies, which tells about what you can use. And then they have guidance documents as shown here and a lot of others. So depending on the type of pharmacy that you're working for, you should be familiar with those guidelines. So one thing I would like to say is go back to your practices. Take off your rose-colored glasses and look up, look down, and look around. If you have stains or vermin, call facilities. Get it cleaned up, because that's what the FDA is looking for. In general, though, it's important to understand that they are suggested shoulds. It's suggested or recommended, but it's not required. But this is how they inspect pharmacies. State Board of Pharmacies oversee all practices of compounding, or all practices of pharmacy, including compounding. So sterile, non-sterile, hazardous, non-hazardous, depends on what your State Board of Pharmacy has written in. And then inspections can occur based on individual state and laws. You know, normally they'll come every year, every 2 years, or maybe more frequently, or maybe, less often. Kind of depends on how many people they have, how many inspectors they have, and how far they can get around. Also, they will visit you on a patient complaint. I've had that happen in our practice back in Tulsa a long time ago. And so inspections will occur, may or may not include USP chapters. So this is where it's important to understand as owners and as DPs what your State Board of Pharmacies are looking for. So on our end, people have come through our training classes. We're getting more and more calls. Hey, I need my certificate from when I did training 15 years ago. Well, legally, our records don't have to go back that far. And so what I can say is you attended it, but doesn't mean you passed it. I don't know. So if you do your programmings, make sure you keep your certificates, scan them, keep them electronically, because you never know if you have a flood or a fire or lose them, because that is important, okay? And understand that, training facilities may not have to keep their documents as long as, what you need. And then another question to ask is, what does your State Board of Pharmacy allow technicians to do job-wise? So that's important to know. Considerations for best practices, dedicated scrubs and shoes. So I have an 80-pound yellow lab, and on the days that I work in training, I have to put him up. And so and he's full hair, sheds like everything, and so I'm coming to the office with dog hair on me. What do you think about that? Rita, what's our policy going to be? Are we going to wear street clothes to work and change in? Or are we going to wear scrubs to work from home?
I would suggest scrubs. Change to clean scrub to work.
Okay, so we're going to change at work? Okay, cool. All right. So have signs. So at your sinks, have a sign that says you have to wash your hands for a minimum of 30 seconds and how to dry. Post signs everywhere, just as visual cues, visual reminders. That's helpful. And then best practices. So Stephanie, We all wear makeup. We all have fake nails. Are we going to allow that in the compounding lab?
No, not in the lab.
Okay. I know it's not allowed in sterile, but we're non-sterile. So your answer is still no?
My answer would be no.
Is that the policy?
Yes, that's the policy.
Okay. So how do y'all feel about that? Everybody other than Stephanie.
Agreed.
Well, her co-partner, Rita, agrees.
Thank you, Rita.
Ladies, how do you feel about going to work with no makeup? Do you do that anyway? Oh, a lot of heads. Because you do sterile? No? Is it because it's a policy, or you just choose not to wear makeup? Okay, you choose not to wear makeup. Got it. Okay, all right. Fair enough. It is allowed on 795's side, but make a policy for what you want to happen. Okay? Gentlemen in the room, what is the problem with mascara? Shedding, correct. All right. So that may be another reason why not to wear makeup. So best practices, garb storage. I would recommend that you put them in tubs and have tubs that have smooth lids because you're going to be cleaning those. And you don't want a bunch of things that have crevices and all that because that's where dust particles can hide. What happens when you open your blinds first thing in the morning and the sun comes through? What do you see? Particles. You're going to see the same stuff, maybe not quite so obvious in your practice. So it's good to store, your gowns that you're going to be putting on, face masks, hair bonnets, all that in tubs, containers, just to prevent contamination. All right, this is a difficult subject, phones. I know you guys are a lot of industry and hospital and health systems, and you probably already have a policy, but on my side, 503As, people pull out their phones inside their hood and take a picture of what they're doing. I had that happen in one of my training classes, and I got angry like that, and I said, you just failed my class. Because I had said originally on day one, this is why we don't do it, because they're filthy. And he just laughed and went on with his way, and I'm like, okay. I would have loved to have withheld his certificate of completion, but my boss wouldn't let me. That's how serious I am about phones. They don't have a place in the lab, even in the non-sterile lab, because of this reason right here. So if you ever get curious, do a surface sample of your phone and let it grow for a couple of weeks. It's not pretty. All right. Another consideration for best practices is to have weekly training sessions. Have staff rotate and teach others. Okay, it doesn't always have to be our 2 DPs. Celebrate the big wins. If you all sent out your capsules for potency testing and everybody passed, hey, bring in pizza. Build a great culture, okay? Find out employee strengths and weaknesses. And then how does that affect their job description? Are they weak in an area that you've given them a job to do? Maybe that's not a good fit. And it doesn't hurt to find out and put people in different places until, they feel comfortable in doing what they're doing. Encourage the whole see something, say something, look up, look down, look all around, what I mentioned earlier, because you want to make sure your facility, if the FDA visits, here's what you need to know about the FDA and their visit. They do not have to prove anything is contaminated. They're going to say that there's potential contamination due to XYZ. That's all I got to write you up for. They don't have to prove it. So you want to make sure that your facilities are really clean. The fact that an employee comes to Yanni and says, hey, there's a dust bunny over here, facilities is not doing a good job, shouldn't be punitive for anybody. Because we all want our jobs, we all depend on our paychecks, and our owners like to pay us, but they also want us to make sure that we have their backs. Because as technicians, we are the left and right hands of all pharmacists, right? And even the owners, whether they realize it or not. So we are important. So the Drug Chain Supply Act 2013 has been rolled out. And basically, they're protecting us, consumers, against counterfeit or fraudulent manufactured preparations. Losartan tablets, Finnegan solution. So they talk about trading partners, and that's anybody who dispenses, or manufacturers or wholesale distributors, all of that. So it applies throughout. but the way they've rolled it out is based on kind of the size of the pharmacy. So basically, we want to make sure that nothing has been contaminated, if you will, or is fraudulent. But it does not apply to compounded medications. So this is not in affect my world, but I know it affects you all. So it doesn't apply to over-the-counter medication. It doesn't apply to animal medications and a lot of other areas. So for November 2024, the requirements are to check registration of manufacturers and repackagers and then check licensing. So you want to do your vendor qualification. That's what we're looking at. And then you want to check your pharmacy licenses and all that. And then you must have an electronic reporting system. You have to have a way to convey, I think I have a counterfeit Finnegan with codeine bottle, okay, or something's been tampered with. So you must have a way to report that. So the processes are, from the manufacturer standpoint, they have an NDC number, which they've changed to include more digits. There's a serial number, a lot number, and expiration date. Well, the last two has always been there. For the pharmacy, you have to have electronic system in place. There is a product verification on receipt of the bottle that you have to look at. And then you need to manage both transaction information and transaction statements. Then you also have to have a quarantine area for anything you think is suspect. And then there's a lot more responsibilities there. There is a exemption for people that employ less than 25 full-time employees for pharmacies. This is so that you can get your system up and in place, and it does expire this November. So if you all were to change out of your current roles and go into the compounding world, what would that look like? So I just want to say, first of all, examine what your interest is. Would you like being a designated person? And understand that I just did 2 examples of designated people here, but depending on how big your practice is, it could be more than 1 person, 2 people, 3 people, because it's a lot of responsibility. So in the compounding lab, you have personnel to look at, you have facilities to look at, dispensing area and receiving. And then you have regulatory affairs, because you're also vendor qualifying. And you're also making sure if you're shipping to other states that you're licensed in those states. So there's a role in regulatory affairs in compounding pharmacy. In general, you can be compounders. You could do data entry. You could be an inventory or a purchaser. You could do tech when allowed by the state regulations. You could even be in sales and marketing. You could go out and call on practitioners and all that and do your advertisement. So what is your interest? What about a compliance officer? Now, I would like that. I like to make sure that there's no bugs on the floor, no hairballs, anything like that. I want to make sure that my crew is doing a good cleaning. I like to write SOPs. I think that's fascinating. I like to train. Documentation doesn't bother me. So are these areas that you would like to do? So these are all areas that have opportunities in the compounding world. Just figure out if you ever want to make a change. What change would you like? Quality control officer is huge. So when I make those suppositories, those progesterone suppositories, and the patient, so basically we'll do a final verification after they're made, pharmacist signs off on it, and they don't pick them up for 2 weeks. So another verification has to be done, and it has to be documented. A technician can be trained on that. And they're just looking to make sure that there's no cracks in the suppository, if it's dispensed in the little mold, there's been no color change or anything like that, that they've been refrigerated. So there's lots of areas for technicians to do. Any questions? Online, any questions? All right, now I'm going to address the folks online. If you have your supplies handy, I know that Judy has sent you guys a list of requirements, so we're going to work with you first. So do you have your ingredients there? Your water, your commercial Aquaphor, or whatever you chose? Butter knife? No? Does anybody online have that? Is anybody online going to do this? Okay. All right, we're going to pause the virtual people. Now we're going to go live. All right, everyone grabbed a bag that looks like this, correct? All right, clear off some space. I gave you a towel, if you'll just go ahead and lay that out. Because this paddle is going into your preparation, lay this on the towel, okay? Whenever we're working inside our powder containment hood, we always put a towel down. It's best practice. And any measuring implement that's going to go into a chemical bottle must be laid on a towel. That's Annie's rule, because if you put it on the work surface that's been cleaned multiple times, how do you know it's really clean? You could pick up a contamination and contaminate your raw chemical that you go into. USP does not teach you this stuff, y'all, unfortunately. All right. So now you have a jar of biopeptide biocosmetic cream. This has some biopeptides in it, okay? And then you also have a syringe of acetylhexapeptide solution. This acts like Botox. It is not Botox. You're going to make a cosmeceutical cream today. Now, this is intended to go underneath the eye area or in the wrinkled area, not in the eye, external use only. Father's Day is coming up. Don't go home and give this final product to someone you love and say, here, fix yourself, because you might get a divorce or get kicked out of the family, okay? All right. So what we're going to do is we're going to open up the jar. You're going to pull off the tip cap. And then I want you to squirt the contents slowly into the ointment jar. Now, I have a drip hanging off here. What I teach people to do on syringe use, can you all see me, is to pull back on the plunger and push several times to get all of that out, okay? And then use your paddle and start mixing. So what this will do is help reduce muscle contractions and therefore get rid of, now I'm not making a claim, okay? But it acts like Botox. Give it a good stir. Now, you guys are doing this outside of a hood. Is this appropriate?
No.
Yes, it is. Why is it not appropriate?
Oh, it's a tablet.
What?
It's a tablet, so liquid.
We have no powders. When you're working in my world, non-sterile, bulk powders, you have to work inside a hood because you're contaminating your environment if you don't. So if you're mixing cream to cream, outside the hood. If you're mixing liquid to liquid, outside the hood. This is why I could not bring a powder to put in here because we don't have any hoods. So we're protecting ourselves, our environment, and the final compound when we work inside a containment ventilated enclosure. Okay? You bet.
Okay, so we're working with this
Microphone,
and
please.
I have it on.
Oh, okay. Can hear you.
We're working with this, but we have product inside this lid.
You can take it out. Mm-hmm.
Would it be considered appropriate to do that?
Yes, her question is there is product inside the lid? I have some too. And would it be appropriate to take it out? Yes, because it is part of the measured amount. That's the only way I could get it down here. So you may have some in the lid, and that's fine. All right, take a little bit of it and just rub it on the top of your hand if you would like, just so you can get a feel of the texture, how easy it rubs in. What do you think? Mm-hmm. Anybody have any questions? Yes.
What would you say when you're making a solution? So say you're compounding tablets, crushing them in mortar pestle, those turn into a powder. I was trained in non-sterile compounding, but now hearing powder, how would you define that?
That has to be done in a hood. Yep. So because your laminar, so the hoods that we work in for non-sterile bulk API powders is different airflow than what sterile is. So sterile, you either have air coming at you, right? Or it's coming down, okay? In the hoods that I'm talking about, so if this is my hood right here, I've got filter up top and the back wall. So it's taking outside air, it's coming across underneath the face shield, across the work surface, and goes to the back. Now, I cannot, if I had a powder spill in my work surface, I cannot shove it back there and expect it to suck it up, because a hood is not a vacuum cleaner and it's not a storage unit, okay? It is simply to remove particles out of the air. So, because I have 2 HEPA filters up top, it's going to exhaust the air back into my room, which is appropriate. So that's how the hoods for compounding work. So it's taking outside air, go across, up and out. Anytime you open a jar or crushed tablets, that should be done in a powder containment hood. Good question. And then you would do an in-between clean and change out your gloves and all that. The thing about USP is they don't teach you workflow. And so in my world, I have on my 1 pair of gloves, I have my formula, my master formula, and then I go to all of my pharmacy and I gather all my supplies. And in your world, you wipe everything down before you come into the hood, right? Sterile? In this way, no. So you're going to place everything. I've got my white towel out here. I'm putting all my implements on it that's going to go into a chemical jar, syringes, whatever I need, because I'm trying to minimize all the contamination. And then I've got my balance always lives in the hood. And then I've got everything set up. But because of this 1 pair of gloves, I have touched a lot of areas of the pharmacy, including going to the printer to collect my paper if I don't have a quality control management system hooked up that I can see the formula on outside the hood. And so then, right before, I'm going to do a double check, read the formula, make sure I've gotten everything in there, mortars, pestles, spatulas, whatever, all the chemicals. Then I'm going to don on a 2nd pair of gloves. Also, in the back of my hood, I'm going to have my cleaning agent, which needs to be an EPA-registered product. Since we're CE, I can't talk about what that would be. I'm also going to put in a Ziploc bag of towels. Because Yanni is a penny pincher, I'm going to count exactly how many towels I may need. So we're going to wipe down, reverse of sterile, we're going to wipe down everything before it comes out. Does it make sense? Because those powders in there have now contaminated everything in there. And I cannot just bring it out here into my environment, because if it was fentanyl, I would be dead. Now, you guys heard about the pharmacy student in 2013 or so, New York. Where's my New Yorker? He was on rotation at a compounding pharmacy and handled a jar of fentanyl and fell out on the pharmacy floor and died 6 days later in the pharmacy. That's how chemicals can just get absorbed through your skin. Your hormones. I can put testosterone powder on my skin and probably get some absorption. Some are very lipophilic. So you have to know what you're working with. And that's why. And then if I'm in my hood and I forgot something, then I can take off my top pair of gloves, come out and go get it. That's the beauty of not having now sweaty hands that I have to put a 2nd pair on or another pair on to go back in and complete the compound. That's why you read your formulas, you make sure you have everything in, you go in, you stay in, and then you wipe everything out before you come out. I also tell people to, if you're making capsules with a capsule machine, to have a tub of water, and then you can tear down your capsule machine and put it in there. That way, if your product that you're wiping it down with, because you're not cleaning anything. You're not cleaning your mortars and pestles. You're just wiping out to get particles off, because then you're going to go to your area where you do your dishes, and then that's when you wash. And you're going to use a lab-grade detergent. FDA will frown if you use Palmolive soap. They will write you up for that. And also get wooden-handled spatulas out of your pharmacies. Okay, thank you. Enjoy your cosmeceutical products.
You're welcome to take a couple of questions.
Does anybody have questions? Nope.
Great presentation. Thank you so much.
Thank you. Oh, thank you.
With gratitude for sharing expertise and inspiring pharmacy technicians.
Well, thank you.
so much.
Thank you. Good job.